Great. So I think we can get started, and this webinar will be recorded and shared externally afterwards. So welcome everyone. My name is Matthew Kusin. I work for Health Equity Matters, formerly AFAO, on the SKPA-2 project, the sustainability of HIV services for key populations in Southeast Asia. I'm based in Bangkok, and we would really like to welcome you to this webinar hosted by the SKPA-2 program. So today's webinar is focused on Let Communities Lead, portrayals of community-led organizations in Asia and the Pacific. And so really what we want to do today, and this webinar is hosted by SKPA-2, APCOM and Health Equity Matters, as well as I'll be introducing UNAIDS, who will be sharing some of our keynote speakers, and then Selvin from APCOM later on will introduce our esteemed panelists, who will, as well as he'll be facilitating a panel session with different community leaders from across the region. And so really today's objectives are to highlight the community-led organizations and their meaningful work, and really based on the theme of World AIDS Day, which is tomorrow, on Let Communities Lead. And so we really want to provide some examples of good practices and innovations in community-led responses and showcase different insights from across the region, as well as identify some opportunities in sustaining community-led organizations, as well as some of the challenges and some solutions and way forward. And so I think for a couple housekeeping items, if everyone can please keep themselves muted throughout the webinar, and feel free to write any questions you may have in the chat box. And so I will hand it over to Scott from UNAIDS to handle some opening remarks and setting the scene for today's webinar. Over to you, Scott.
Hello, thank you very much. Thank you for that introduction. Dear friends, colleagues, it's a real pleasure to be here today and to be able to represent UNAIDS Asia Pacific in this important event. So as you know, World AIDS Day, we're celebrating the contributions made by communities of people living with HIV, key populations, and other civil society organizations. It's thanks to their courage, your courage, and activism over the years that we have effective HIV treatment. It took community pressure to make medicine more widely available when it was first developed. And in fact, it's community pressure that continues to evolve the availability of medicines, of commodities, of responses across the spectrum that are required. In fact, the continual evolution of the HIV response is largely down to community pressure, activism, and the voicing of the needs of the people who are at risk or in need of support. And without a consistent push for rights-based response, we wouldn't have the HIV service delivery standards that we aspire to in these days. So we rely heavily throughout the world, and including here in Asia Pacific, on community monitoring, community pressure to uphold the standards and ensure that people's needs are met. Without the helping hand of communities, the HIV response would be leaving many more people behind. And these contributions by communities in all their diversity have been made right from the start of the response to HIV more than 40 years ago. So this is not new, and it's still very relevant today. So yesterday, UNAIDS launched the 2023 World AIDS Day report called Let Communities Lead. This report tells us that although community leadership is a powerful force, it's under-resourced, it's under-supported, staff are often underpaid, and sometimes the members are even under attack. So the Global AIDS Strategy 2021 to 2026 recognized this with new targets for community leadership. And these targets call for community-led organizations to deliver 30% of testing and treatment services by 2025. It calls for 80% of HIV prevention services for people from key populations to be led by communities by 2025, and for 60% of programs to support the achievement of social enablers by 2025. Now, to put that into context, in 2012, so just over a decade ago, almost a third of all HIV resources worldwide were channeled through civil society organization. Now, over the course of that decade, the resources grew, but not for communities. So by 2021, only 20% of funding for HIV was allocated for civil society. So the 30, 80, 60 targets are a call for this trend to turn around sharply. It needs communities to engage with governments, with donors, and the development community to ensure that these targets are met. So where are we in the response to HIV in Asia and the Pacific? At the end of 2022, an estimated 78% of people living with HIV in Asia and the Pacific knew their status. 84% of people who had a positive HIV diagnosis were on treatment, and 95% of people on treatment had achieved a suppressed viral load. And as we know, if you have a suppressed viral load, you cannot pass HIV to a sexual partner. So it's vitally important that we, and that is we, the communities, find the means to increase testing and treatment services. That's how we will reach the people who are currently being left behind. So at the present, 96% of HIV infections in Asia Pacific are among key population communities, with almost half being among men who have sex with men. A quarter of all new infections are among young key populations between the ages of 15 and 24. There are rising epidemics in some countries: Afghanistan, Bangladesh, Fiji, Papua New Guinea, and the Philippines. But in some countries where new infections are falling overall, new infection rates among men who have sex with men are either stagnant or increasing. So we need an urgent focus on concrete population-specific interventions led by communities. It's not just a service delivery challenge. The SKPA-2 project focuses on removing barriers, the human rights and gender-related barriers to services. And that goes to the heart of the Global AIDS strategy and its emphasis on ending inequalities. So 4 decades into the HIV response, we know that HIV is not simply a health issue to be addressed through health services and medicine. We have to break down the structural barriers and the inequalities that are blocking people from enjoying lives free of stigma, injustice, and violence. And here too, communities are critical. Your advocacy is challenging, and it holds the potential to shift the needle on these issues, creating the best possible chance for HIV services to achieve their greatest impact. I just shout out to APCOM for its focus on community leadership, enabling and celebrating the role of communities across the Asia Pacific. It speaks to a deep understanding of this issue. So we have joined this call in order to recognize APCOM's vision and commitment in this regard, as well as those of the other communities we'll be hearing from today. We're proud to join with all the stakeholder communities to prioritize 3 strategic advocacy priorities to supercharge the community response to HIV. Firstly, communities' leadership needs to be central to all HIV plans and programs, including in the concepts, the budgeting, the implementation, the monitoring, and the evaluation. Secondly, community leadership needs to be fully and reliably funded, with community workers properly remunerated. And thirdly, we have the challenge of breaking down barriers to community leadership roles, including by ensuring there's space for civil society and the proverbial seat at the planning table, while working to protect human rights for all. We're determined that the slogan of World AIDS Day 2023 is not a one-off initiative. Instead, this is one more step on the path to ending AIDS by putting communities at the center of the response. So Let Communities Lead is a rallying cry for communities across the region and across the world. And it's part of a multi-year effort to deliver on the promises of the Global AIDS Strategy. To forge this path together, we must continue to create opportunities and to be inspired by the incredible work already being done. Therefore, in order to celebrate these efforts and to truly understand not only what we'll hear today, but to also focus on some of the communication and activism learnings that can be achieved, I'd like to also invite you to join UNAIDS Asia Pacific tomorrow for the regional launch of the World AIDS Day report. APCOM will be joining us and other community partners. We're holding a share fair where we will invite everybody to pitch in and discuss what works. How can you make breakthroughs, particularly around communication advocacy? So I hope you'll find this meeting energizing and useful, and I hope that you'll join us tomorrow as well to share your thoughts, how we can make progress together. Thank you. Over to you.
Great. Thank you so much, Scott, for that wonderful introduction, setting the scene for our World AIDS Day in this webinar. So next up, I will pass over to Selvin Anthony from APCOM, who will be help facilitating the next panel, as well as introducing all of our panelists. Over to you, Selvin.
Thank you so much, Matthew. That was the wonderful discussion from Scott. So my name is Selvan Anthony. I'm working in AppCom. I'm going to facilitate this session. So this session will have 5 panelists, and it will allow them to share their insights and experience about their engagement in the HIV program or work at the country level. Before I ask them some questions, I would like to introduce them. So we have 5 panelists. Number 1, we have Tenzin Gelshan from Bhutan. So Tenzin is the executive director of Pride Bhutan. To Pride Bhutan, Tenzin is actually promoting the social, psychological, physical, economic, and legal well-being of individuals who identify themselves as LGBTQI and other key affected population, which includes young key population, youth, and adolescent. Thank you, Tenzin, for joining us in this panel discussion. The next one is Leslie from Bula. Leslie is the Executive Director of Key Population Advocacy Consortium in PNG. He is working in HIV sector for more than a decade and strongly contributing to build the capacity of the key population communities in PNG. Thank you, Leslie, again for joining us in this panel discussion. The third one is Gabriel from the Philippines. Gabriel is working in ASH as a volunteer for advocacy work for more than 2 years. He works as a community-based screening motivator, prep counselor and trainer for community-based screening, motivational counseling, and intimate partner violence. Thank you, Gabriel, again. We have Tien Van Dino from Vietnam. He's a deputy director of Pluto Social Enterprise, which is a KP-led social enterprise in Vietnam's capital city, in Hanoi. He is responsible for the organization's strategic planning and financial management. He is also the public speaker and advocate for the work of Pluto and the needs of MSM community in it. And the last one is Latavana Sengdala from Laos, who is also called as Kai. Kai is working in Chias in Laos. She identified herself as a transgender woman. She started to work on HIV program as a volunteer and later started to work as an employee in Chias. Thank you, everyone. So I'm going to ask you some questions. So here I kind of, wanting to have more interactive session. So the first question to all of you panelists is, how do you actually see the meaningful engagement of communities in your country on the HIV work? So when you're explaining, I would really appreciate if you give one specific example of community engagement at the country level. Thank you. So I can put a spot on Tenzin. Tenzin, would you like to give a response on this?
Yes, thank you, Selvan and Health Equity Matters for inviting for this webinar. When it comes to meaningful engagement, I think the first word comes to my mind is representation at all levels when it comes to HIV programming, not just HIV programming, but when it comes to interventions to the key population in our country, actually. So if I have to give a specific example of what has really worked, I think over the years, we have seen now national program giving more responsibility to CLOs, community-led organizations, more responsibilities when it comes to mostly community mobilization here in Bhutan. I think we have done it very successfully, which has also contributed to successful implementation of community-led HIV self-testing interventions here in Bhutan. But I think when you look at the meaningful engagement, I believe that that the community should be at the forefront of HIV service deliveries, while national programs and the government should be at the background providing policy support to the CLOs. Because without them, I think it would be very difficult to implement these activities in our countries. Thank you.
Thanks, Tenzin, and well said. The community should be at the center or the forefront, and of course, we need support from the stakeholders. I would like to ask the same question to Latawan Singdal Kai. What do you think about meaningful engagement of communities?
Thank you, Sewan. The meaningful engagements of community allow we know on health sector we know only MSM and TT. For sure, our country will on this program focus on MSM and TT. They are we are also the part of HIV prevention, and we are also do the volunteer do all this work, provide HIV testing, delivery ART to the client and our community. Also do the HIV cell testing. Also the community, they can also do the HIV cell testing by themselves. I think this is the good point that we can conduct the activity like this, not only visit the healthcare provider only. And other thing that I would like to say that we also have the online counseling on web page like test VTE page on Facebook, or you can booking for HIV testing and get prep on that website. This is start from our community. Yes, Silva.
Thank you so much, Kai. Gabriel, you have any response on this?
Thank you, Savan. For Hash, we actually have been focused on a few things for community engagement, and two things come to mind. One is getting the U equals U message across. For this, we ensure that we spread this message across to all means available, especially keeping up with the time, making sure that we do it online as well. We include it in our materials and make sure that it is available as well during training so that everyone is aware on and how effective it is, and that there's definitely knowledge behind it and research behind it. The second thing that we're focused on is trying to reach the hard to reach population. We make sure that we build a safe space for everyone in every corner of the organization, and we also actually encourage our different KPs to be part of the organization, especially if they're hard to reach, because they will feel belongingness if it's someone from their own key population, right? So we make sure to not only help them, but we also learn from them. So that's what we do for community engagement.
Thank you, Gabriel. And of course, learning and sharing is very important. And you also mentioned about how to reach population. Of course, we also need to reach them by doing innovation approaches or method so that no one is left behind. Van, over to you. What do you think about this community engagement at the country level?
Yeah. So when talk about meaningful engagement by the communities, the first thing comes in my mind is the reduction of stigma and discrimination to the people living with HIV groups in Vietnam. Because in Vietnam context, in the past they used the fear approach to HIV. So they spread fear to the whole societies, and everyone's scared of HIV, and they form the stigma and discrimination for those who living with HIV. So the community see that, and we spend a lot of time and a lot of effort in meetings with government to change the way uh, people living with HIV are called in official letters, official documents, and they change the way they approach people with living with HIV. And now people living with HIV has a more neutral view, and they are getting more support from the societies, not fear anymore.
That's great. It's very good to know how you are actually contributing to reduce stigma and discrimination for the PLHR people in Vietnam. Thank you so much. I would like to ask you the next question. I know you are the great leaders and contributing a lot of things to your organization and to the communities you serve. My question to you all is about the leadership. So how do you actually think the leaders in your organization are effectively driving your organization to contributing to attain the national and the global AIDS target? So any thoughts, any opinions on that? Maybe I can start from Van.
Oh, thank you. I'm going to start these questions. So, talking about leadership to contribute to the national targets. So, in Pluto, we believe that our community are very strong. So, but we also see that the community's members, the KPs, are lacking of knowledge, and they are still hiding themselves, uh, which is because of social stigma and discrimination. So what we are trying to do is to provide knowledge to as much people as possible through online event and online campaign. And also we try to expand our community outreach network so that more people know about testing, more people know about HIV counseling service. So they are not afraid of getting tested, or they they will have more chances to go and check for their HIV status. So that's pretty how we are working.
Thank you for sharing that. And again, sincere apologies if I'm not taking your name properly. So please let me know if I am not taking your name properly and how to pronounce your name. So yeah, Gabriel, over to you. What do you think about the leadership?
As for leadership, of course, Hash is structured in a way that our volunteers can seek help. With of course, there are frontline people, and we want to make sure what they do, they get guidance and assistance so that it would effectively be positive into the overall HIV goal. And also, we have M&E systems in place to make sure that quality recordings are done on our activities. Hash is actually also active in both implementation and dissemination for the community-led monitoring. Hash was the one who piloted it, and we are now helping other organizations to start it so that it would help the overall goal that everyone here has.
Thank you, Gabriel. Tenzin, any thoughts on this?
I think when it comes to leadership in Bhutan, if you look at the CLOs, I think the leadership has committed so much of the time, their resources. I believe that the CLO leaders are very committed. You can see uh, the way they work actually. You can see from that also. But then if you look at the whole national program, I think because of the whole civil service transformation thing that is happening in Bhutan, and the whole trend of people going to Australia, I think there is a lack of we are now feeling the brunt of human resources, lack of human resources, especially if you look at the national programs. All the senior national program has left out of the country and went to Australia. Now new national programs are coming, but then I think I really needed to remind our new programs that there should be willingness from the leaders to listen to the CLOs things. And one thing that we are looking with the new leadership is now that inclusion should be there, because if you look at HIV interventions or HIV programming, I think we are going by the risk behavior only, especially when it comes to sexual intercourses. The risks, people are included according to the risks of getting HIV in terms of sexual behavior, their sexual behavior. But then if you look at our country context, you can see that alcohol is very, very accessible here in the country. If you walk in the town of Thimphu, especially in Thimphu, not just in Thimphu, but in other towns in Bhutan, you will find bars in every corners, and it is very accessible even to the young people or the minors, which is actually driving or putting our young people into risk of getting HIV because of alcohol. And we don't see the inclusion of CLOs who work in this field. I think that is where we should also look moving forward.
Thank you, Tenzin. And Sky, what do you think about the leadership?
Thank you so much. For the leadership in our organization, for sure, HSV work is our priority. All the staff that working on HSV work, I believe that they are quite expert on this, because we are from the community and we know how to reach the community, how to speak with them, how to engage them. And not only our organization that we want to be the leadership, but we also try to build in next generation, new generation to be a part of this work, and try to build them to be the leadership in community. Not only in our organization, but also in community. They can to provide HIV or provide PrEP information. This is also the leadership, in my opinion.
Thank you, and it's really great to know from you how the leaders or you working to contributing to attain the global and the national targets. And some of you have said the online and offline campaign, that is for raising awareness on the HIV, and the health related thing, and about the M&E systems. And of course, Tenzin, you rightly said about the M&E system that is in place. And also the CLO leaders should also be very committed, right? And they should also be like looking beyond HIV. This is not HIV, in order to, make sure that we are like, supporting everyone. And the other one is about, we are the communities, of course, we have the power to bring in the next generation and empower them, to contribute to attain the HIV and the national targets. And my next question to you all, what do you think about the government or the stakeholders in your country supporting and valuing the key population leadership in the overall HIV response? Ariel, you want to go first?
Sorry, was that me?
Yes, you are the one.
Actually, to be more specific about the government and other stakeholders, one of our last project, our key focus was to strengthen the government and CSO relationship in Quezon City, one of big cities in the National Capital Region. We were actually able to involve 84 barangays, and it had 129 participants, from their health workers to their officers or to their officials. And what's good is that we are now supporting them with their own projects and helping them build capacity, so that whenever they will have future endeavors, we'll be there to help them, and they will have their own force or their own team. This helps with the overall HIV response, and our goal is to be able to replicate this in different areas, so that the country itself would have a better overall HIV result, or towards the overall HIV response.
Thank you, Tien.
Yes. Talking about governmental and stakeholder support to the community's work, I can say that the community, the KP, the key populations in Vietnam are being put in the center for every decisions. I can give examples. For example, whenever they have research, they are going to have research for the key population groups. They will invite the members of the key populations to give advice and give more information to that research. Or when there is a new law is going to be presented to the National Assembly, there is a how to say, community advisory board, and the board members are being invited to discussions to contribute to say what the communities needs to that law. And I think that's I really feel that the communities are being put in the centers for every decisions of the related to the community.
Thank you, Tien, and well said that the community should be at the center and in all the decision-making processes. We also have Leslie. Leslie, thanks for joining us. We are actually talking about the government and other stakeholders in the country and how they are actually supporting the key population leadership in the overall HIV response. Leslie, you have some thoughts or the comments on this?
Yeah. Good afternoon, everyone from Papua New Guinea. My response to that is it comes down to our individual organizations. We need to build up our organization. We need to bring credibility to our organization, put in systems in place so that when we're talking to our partners, the government body, at least they know that we are organized. So when we started KPAC, we had to build our systems on board so that it's transparent and it represents the community. So once the government sees us and hears us in our discussions and we demonstrate leadership skills and credibility, and then that's where they start recognizing us, and they start involving us meaningfully in any program. So that's my experience from the organization I'm running, KP Advocacy Consortium. Yeah, that's.
Thanks, Leslie. I think there's some network problem. I really like what you said about being open and transparent to the stakeholders so that they can really support us and involve us meaningfully in the decision-making processes. I would also like to hear from Kai. What do you think about this in Laos? Kai, you're mute. You have to unmute. Kai, you're mute. Yes.
Sorry. Talking about the government, actually the government is our main partner on HIV work. We used to collaborate with them on IBBS among MSM and TG in Laos many times, and also rapid assessment on people who use drug. I think it's a good collaboration between our organization and the government. Most of the time, they develop the guideline about HIV prevention, PrEP, HIV self-testing, and also reduce stigma and discrimination or mental health screening. And they also support us as a trainer sometimes. Yes.
Thank you, Kai. I kind of really like the approach what you talked about the government, right? You are actually continuing your collaboration with the government, especially they're also including the CHIAs for training program, right? Thank you for sharing that. How about Tenzin? What do you think about this?
I think one of our colleagues talked about transparency and everything. But what I believe is that the communities have actually proven their worth actually in terms of having systems in place, in terms of being transparent, in terms of willingness to work. I think there is no question about that. We have proved our worth to the government, to the stakeholders. Look at the panelists today. Apart from me, I believe we have a trove of experience and knowledge when it comes to community interventions, HIV interventions. We actually have Kai, who actually received Hero Awards. She's recognized actually. Kai is recognized because of her work. There should not be any question about our work and our work actually, because we have proven it time and time again actually. But then moving to Bhutan, when it comes to supporting our key population leadership and key population themselves, I think our country as especially Save the Children Bhutan, and then we have our regional PR for SKPA-2 Health Equity Matters. I think they have done a very good work when it comes to bringing the communities and the governments together. I think now we see that the national programs and other stakeholders, they value our inputs and our opinions. I think that shows that we have come a very long way. Thank you.
Thank you, Tenzin. And it's not easy, right? Because, the government will only value when you have a very continuing relationship with them. When they start believing you, of course, they will be valuing you. And for that, I think you need to have a very, very consistent and persistent effort, right? Collaborating with them. Thank you, Tenzin. My next question, this is more about your organization. So according to you, how you see your organization is creating an impact to the key population communities that you serve? So it's not a difficult question. Maybe I can, oh, Leslie is not here. Maybe I can ask Kai, what do you think about this? Kai, you are mute. You have to unmute yourself.
Sorry again. So on the point, as I mentioned that we have our risk worker, our volunteer to provide HIV services. And also we have the online platform, HVTE website, HVTE Facebook page to provide the information to our community, and to make them easier for get HIV test, they can booking online for HIV cell testing, and they also do the counseling with our team by online before they get the service. I think this is the impact for the community, because our website is in Lao. Before, if we need some information about HIV, we have to share in English or in Thai, but today we are available in Lao language. This is I think it's good for our community.
Thanks, Kai. We always look for long-term change, a long-term impact for our communities, right? And thank you. And I really appreciate the work what you're doing in Laos. Let's go to Leslie. Sorry, the name is wrongly written. Sorry, Leslie. Leslie, what do you think about your organization or the consortium creating an impact for the communities that you serve? Leslie, you have to unmute yourself now.
Sorry. Okay, I'll start again. First of all, as a leader, you really need to set down your foundation. And if your community is key in your response, you really need to look after your communities first, meaning you really need to build a capacity, you need to build a relationship with your community. The consortium is made up of 7 components that I have, so it's very diverse. So being in this leadership role, you really need to be in tune with the various issues they face, and also what are the challenges that they have in common. And so you need to set yourself right first as a leader in order to lead the organization. And then when that's done, my experience is delegating tasks to various leaders. It really helps the organization grow. So training them to know specialized areas, and also giving them responsibilities so that they know they can support you as a leader. And that brings impact to all the communities because they reach out to their respective networks. So as an executive director, I just sit there and coordinate all the work that are done in the communities. And also, your communities are very key also to support you in various areas and networks. So you really need to be in tune with the issues they face in each areas, and also address those issues one by one. Because if you just leave an issue, it will pile up with another issue. So listen to your community, and also try and get them to do solutions for them to solve the problems themselves. And it's very important also to bring tools into your organization. So when you're doing your interventions, you're reporting on credible data that we collect as an advocacy organization. And also, lastly, partnership is very key. Our partners has brought us here, and I appreciate all the partners internally and externally. So that brings your advocacy program very effective. Thank you.
Thank you, Leslie. And really like the way what you said, look at the communities and take care of the communities, as well as look at yourself internally before you create an impact. If you're not strongly established internally as an organization, how you're actually going to create an impact, for the community. So that is very important. Gabriel, what do you think about this?
Sorry. For me, Hash has been quite successful with reaching and educating key populations, and it gets stronger as time goes by. In the past 2 years that I've been around, of the initial difficulty was reaching the trans community, and we were slowly able to learn from their community as well and how we can reach them further. We were able to create programs for them. And for this year, our focus was on our young people population because we're seeing that the trend is going down when it comes to age, and we want to make sure to educate more people. We are now in collaboration with multiple universities for testing programs, seminars, and we actually concluded a training last week wherein a quarter of the training participants were from the young key population. Our goal is to be able to reach more from different areas as well and reach other KPs that are difficult to reach, such as the people who inject drugs population and the sex worker population.
Thanks, Gabriel. Of course, if you want to create an impact, we shouldn't be working silos, right? Otherwise, impact will not happen, right? We have to do partnership with the stakeholders and the government for creating an impact, of course, with the communities as well. How about Tian? What do you think about this?
So talking about the impact that we made, we have done a lot of trainings and workshop in university, and recently we do some workshops in high school too. And as a monitoring and evaluation officer, I can easily see the changes in the numbers of in the age and in the numbers of clients who comes to the clinics, and the qualities of the clients also increase because now the clients have the key populations now having more basic concept, basic ideas about HIV testing and PrEP, and they spread that message throughout the communities, and that is more and more people know about protecting themselves with PrEP and testing.
Thanks, Tian. And I really like the work what you're doing, especially on the training thing, because if you want to create some changes or behavior changes, you have to start from the scratch, that is training the communities and see what is happening at the community level, right? And of course, you are the many guys, so I think you have all the tools and the indicators to measure the changes. Thanks for that. I would like to ask one more question, and this is something which we are all struggling about the as an organization, as an individual, I would say this is about the sustainability. You know, what do you think? How we can sustain ourselves as an organization? Any thoughts or messages on this? We can ask Leslie. Leslie, you are mute. You have to unmute yourself now again. Yes.
Okay. So I see sustainability in two ways. So we have short-term measures and long-term measures. So in terms of short-term measures, all the trainings we do, capacity buildings we do, putting in systems in place, those are short-term measures that we want to reach a long-term goal. So I strongly believe that if we build our systems today, getting our act together, organizational resources as well, staffing and all that, in the long term, we'll be able to sustain ourselves as an organization, we'll be matured, and we'll be able to implement ourselves. So I strongly believe that building up your house, building the foundation will help you in the long run to help that house stand firm. So at the moment, KPAC is doing that. We're making use of all the resources we can do, training our people, so that in the future, when I leave, our communities can take over leadership, and also the organization will be reputable in the community, and we'll have partners helping us from the private sector over to other partners that will sustain our organization. Thank you.
Thank you. Since we are running out of time, maybe I will not ask the same question to others, but I would like to really ask from you all about one key message It can be a word or the sentence. Since you know that, the World AIDS Day, we are going to celebrate on the 1st of December, 2023, right? So what is the one key messages or a sentence you want to actually say about this? Maybe we can ask you first. Blue, yes.
Sorry, who?
Yes, you,
Oh,
Gabriel.
sorry. My key message to our key population would be to get involved. I believe that gone are the days that the people in the advocacy or those in the medical field are the only ones who should know and join this movement. Each member of our key populations needs to be involved so that we can effectively combat, especially in the Philippines, that the HIV cases are rising. And with more people involved, we can chip away at the stigma and discrimination that is still prevalent to this day.
Thank you, Tian.
Yes, I think my message is simple. I think knowledge is the power that can help us achieve a lot of things, and we are very close to the target 1990, and the community can be stronger with more knowledge. That's what we want to do in the next year.
Kai.
Yes, my message very short. For the community, I think they should have the opportunity to speak out on what they want on HIV services, and especially for transgender people, they should get the services equally like the other. Yes.
Tenzin, over to you.
So after thinking for a very long time, from last night, I believe I have come up with 3 words, which is your voices matter. I believe it goes in line with what Kai had said. I think every community has different needs when it comes to how we deliver HIV services. Although HIV service can be same, but the deliveries, the methodology for deliveries can differ from population to population. I think their word should matter, because you will be surprised even today the kind of knowledge and innovative ideas they come up with. I think it's time that we really should listen to our community members rather than we deciding what is best for them. I think it should come from them on what they need actually.
Thank you, Tenzin. Leslie?
I think from me is I want all of us in our organization to listen to some of our community members who haven't had a chance to speak out. So as leaders, let's stand back and encourage all those silent ones who want to be involved, but they haven't had the opportunity, to give them the opportunity. I mean, we're all confident here, we all talk, but there's a few others out there who want to bloom. We just need to encourage them to come out and support us in our program. Thank you.
Thank you. Since we are running out of time, I'm going to close this session. I'm going to say thank you. Thank you, everyone. Tian, Gabriel, and Kai, Tenzin, and Leslie, for sharing your thoughts and experience about the work what you're doing. However, if some of the audiences or participants has any question, please feel free to put it in the Dropbox, with specific name of the panelists whom you are actually thinking of asking question, and the panelists can really respond to their question. Thank you. I end here. I hand over the mic to Matthew. Matthew, over to you.
Great, thank you so much, Selvin, and all of the panelists. So actually, I will ask Midnight to have some reflections on this panel. Midnight, over to you.
Hi, thanks so much, Matthew, and thanks so much, everyone, for joining this conversation. Yeah, particularly for our panelists, Tenzin from Bhutan, Leslie from Papua New Guinea, Blue from the Philippines, Tien from Vietnam, Guy from Laos. And as Matthew mentioned at the beginning, this is part of the program that we're doing together, supported by the Global Fund, APCOM, and Health Equity Matters, in terms of ensuring that we're looking at sustaining the response to HIV/AIDS in the region. So the SKPA-2 program, the name is like Sustainability of Services of Key Populations in Southeast Asia. So this is a multi-year program funded by the Global Fund. And APCOM is working on 3 of the programmatic pillars on improving strategic information, to promote programmatic sustainability, and to remove human rights barriers to services. And this is being implemented by in 4 countries, Bhutan, Mongolia, Philippines, and Sri Lanka. And as part of our work is also to ensure that there is this learning. And I'm so happy that we are able to be part of this. Scott McQuaid, the regional advisor on policy, knowledge, and partnerships at UNAIDS, mentioned about the targets for the 30, 80, 60 targets. So I just want to repeat that. What does that mean? So these targets were adopted by member states in the Global AIDS Strategy. So this mentioned that by 2025, so not very long now, just over a year, communities, we will deliver 30% of testing and treatment services, and that 80% of HIV prevention services will be delivered by the community, and then 60% of the program support for achieving societal enablers. So these are the advocacy work that you are all doing. The panels that was participated by Selvan, I just want to maybe just give a quick recap. Tenzin mentioned about representation at all levels is very important for key populations, so that they can be seen meaningfully engaged with particularly government organizations. So they have to be at the forefront, and then governments and other stakeholders can support from behind, particularly on the policy support. Blue mentioned about in importance around the messaging for U equals U, and the organization being able to effectively put out these new messages around, you're not going to pass the virus if you're undetectable. And that the organization is looking to be a safe space for everyone, so that those that are key populations can be part of the organization, but also help to reach those that are harder to reach. Tien from Pluto in Vietnam mentioned about the reduction in stigma and discrimination. So we are now not talking about this fear-based campaign. Community organizations are now leading these interventions, so that key populations can have the access to services that they need without fear of stigma discrimination. Guy mentioned about meaningfully engaged with the key populations in Laos, so mainly in men who have sex with men and transgender populations. And actually, Guy mentioned about having the test BTE. That's very much about building their own capacity within the organization to reach to their populations around HIV prevention, outreach, HIV self-testing, and people can do online counseling and booking to get testing and get pre-exposure prophylaxis. Leslie mentioned about the leadership, which is so important, about organizations that have to build their own capacity to be able to be credible, so that other stakeholders can see us as also credible organizations. So Leslie mentioned about, we need to be able to demonstrate leadership skills and meaningfully engaged with our populations that might not have the chance to also voice out their concerns. I also want to shout out to Joshua for Formentera, who also mentioned about this in the chat box, that organization leaders have to also demonstrate this integrity as well as transparency. I want to say, lastly, thank you to everyone for all your work. As Scott mentioned, the at the global level, we know that, we are powerful. We know that without us, the HIV response will not be where it is now, but there is still a long way to go. And unfortunately, funding to community-based organizations, community-based leaderships, to community-led interventions are not funded. So we are looking to work with you all and making sure that at the political level, we have that political will to really invest in organizations on the ground to ensure that you have the systems, the management, and also the flexible funding to be able to respond to the needs of your communities as and when it happens. I want to say congratulations again to both guys who just received the Transgender Hero Award, and also to KPAC KPNG that received the organization Hero Awards just on Friday. You have demonstrated leadership skill, and we hope that this can also help to shine a light on the work that you're doing for your communities. And for those that are representing here, please do send in your nominations for next year's Hero Awards. Over to you, Matthew.
Great, thank you so much, Midney. On behalf of Health Equity Matters and all of SKPA-2, I just want to thank all the panelists and speakers today for their invaluable insights and perspectives. So Health Equity Matters, formerly AFAO, is actually the peak national body representing Australia's community HIV response, birthed actually in the 1980s as a key population-led organization. And so we really center key population leadership in all of our work. And even to this day, as a key population-led organization, our vision is really working together to end HIV transmission and reduce its impacts through leadership, advocacy, and community-led action in Australia, as well as across Asia and the Pacific. And so we really strongly believe in the need to have key population members in leadership, as well as in governance positions, including in our own organization. And so our board of directors is actually comprised of community representatives across the key population spectrum within Australia. And so we also partner with, through SKPA-2, with key population-led organizations. So really today has been truly inspiring to hear from, different leaders from across the region, from different key population groups. And really, I think these discussions have underscored that we need to continue to have strategies grounded in lived experiences from different communities who are affected, and that we must continue to find space and platforms for them to share their experiences. So thank you once again to all of our speakers, participants, co-organizers, and all of you for taking the time today. I hope you had a pleasant day and learned a lot. And we'll be sending out this recording later on today. And we look forward to continuously engaging with you through SKPA-2. So thank you, everyone, once again. And thank you especially to our panelists. And hope you have a wonderful day. Bye-bye.